Hello, my name is Burak Antarsi. I'm an associate professor at the University of Ottawa and the founding director of the Next Generation Communications and Computing Networks Research Lab at the University of Ottawa. I'll be presenting our work entitled Bridging Predictive Analytics and Mobile Crowd Sensing for Future Risk Maps of Communities Against COVID-19. So this is actually a paper that we have published as a part of the proceedings of the 18th ACM International Symposium on Mobility Management and Wireless Access, MobiWAC 2020. And this is in collaboration with our industry partner, Novit, which is an Ottawa-based company, and also the University of Central Florida. Now, I'll give you a brief overview of our project, actually, that has led to this research. So this project is supported by Answer Canada, and it's titled Artificial Intelligence-Based Decision Support System for COVID-19 Mobile Assessments and Optimal Supply Services During the Pandemic. So what we are basically doing in this project is, well, everything actually starts with a social contact network. So the social contact network can be obtained through data, through mobility data of communities. So if you have mobility data, it is possible to model social contact networks within the communities and across the communities. So that mobility and interaction data allows us to obtain risk maps of the communities. And the risk maps of the communities will give us the risk scores subject to the populations of those communities and the number of confirmed cases in those communities. Now, we need an AI engine here. This is actually the major contribution of this project. So the AI engine helps us making optimal decisions for mobilizing the tests for the disease. Because what we have learned here during the pandemic is that rapid testing is key to resolving this crisis, because rapid testing helps us understand how the disease is being spread among the communities. So in order to enable and facilitate rapid testing, we need to mobilize these assessment centers. So in order to mobilize the assessment centers in an optimal way, we need an intelligent back-end to make these decisions, to help us make these decisions effectively. And another thing we've learned during this pandemic is the supply chain services being really fragile in an environment like this. So given that our supply chain services are fragile, we need to also make optimal decisions to be able to manage the supply chains, or to be able to provide optimal decision support to the supply chains. So this is what this project is about. And I'll talk about how we started this research change. So in our earlier work at the very beginning, back in May, April and May timeframe, we used a self-organizing feature map based decision support backend to deploy these mobile assessment centers to be able to catch the unassessed population as the disease is being spread among the communities. So what you see here actually in this graph is the spread of the disease within a community over a month period. And this is how the unassessed population in that community changes throughout the time if we randomly deploy these assessment centers. And this is if we plan these assessment centers based on uniform planning. So uniform planning at the end of the 15th day in a month, this is where we end up. And this is where random decisions end up? Well, if we follow the self-organizing feature map based decisions to mobilize these assessment centers, okay, in a region, well, this is where we end up at the end of the 15th day. In other words, we are able to cover the population, the infected population, at the end of the 15th day if we follow the decision support provided by our AI engine here. And this is just for a single community here for this mobile assessment center, as you're seeing. So this work was published earlier in the International Journal of Environmental Research and Public Health back in May. So the details of this work can be found here. Now, this work also paved the way for what we have done in this paper that I will be talking about now for our ACM MobiVac study. Now, this has 4 blocks here. So we are aiming to obtain the mobility patterns from crowd sensing campaigns, because the important thing here is to obtain mobility data, because mobility data will give us the risk maps of these communities, the contact network of the communities, and the contact network of the communities will help us model the interaction in the communities, and it will enable us obtain some risk scores for these communities. Now, the first block is any ongoing crowd sensing campaign, because the ongoing crowd sensing campaign, as long as we have people who have opted in these campaigns, will be able to have the individual mobility patterns during those campaigns. And those mobility patterns will reveal some communities, because if 2 individuals opt in the same campaign to sense the same tasks in that campaign, well, they already become a part of the same community. So what we want to do here is, when we have these mobility patterns, this can undergo a clustering algorithm to obtain some clusters of crowd sensing campaign participants. And what we call these clusters is the communities here. So community here is not only a special concept. The community here is a part of the mobility pattern, a part of the mobility data that we obtain from the crowd sensing campaign. So based on their mobility behavior, based on these individuals' mobility behavior, we obtain different clusters. And an individual that reveals the same or similar mobility behavior with another individual is assumed to be a part of the same community, because they interact with each other through an ongoing crowd sensing campaign. Now, when we have these communities, well, we can have the future risk factors for these communities. So this will help us obtain future risk scores of these communities. Okay, and we can obtain the heat maps of these communities, as I'll be talking about that in a few seconds. All right, so this is the main idea. So what we want to do is we want to obtain these risk scores ahead of time. So we don't want to analyze the data that occurred now, but we want to predict where these communities are moving and where they are heading in terms of the risk scores. So this is a part of our numerical results I'll talk about here. So we use 2 metrics here. One of them is the dependability of our prediction, and the average dependability of our prediction. And the other one is the foresight metric. So we use foresight to denote how early we can predict the risk scores of the communities. So the dependability here, the average dependability here, as you can see, we have two scenarios, by the way, I forgot to mention. In the first scenario, we have 10,000 participants in the city of Paris. In the second scenario, we have 30,000 participants, again in the city of Paris. So compared to the city population, the participation ratio here is 0.47%, whereas in the second scenario, we have more than 1%, almost 1.5% participation from the city population. So that those were two scenarios in the simulation study. Now, we tried different number of communities, and I'm showing you here the best results that we obtained in terms of the communities that were obtained during the clustering phase. What we see here is we tried actually 3 different clustering methods. And as you can see here, the expectation maximization algorithm gave us the highest dependability, which means that the risk scores that we obtained 20% ahead of time were correct with this success value. So that's what the dependability, that's the relation between foresight and dependability. So 20% ahead of the time, we are able to estimate the risk scores of the communities. The risk scores of the communities depend on the distance between the individuals in these communities. So in the paper, we explain this in detail, how we formulate the risk score of a community and how risky an interaction is. So if 2 individuals in the same community, if they are within a predefined circle, well, that interaction is said to be a risky interaction. So if you are circled with more number of individuals within that circle, well, that increases your risk score. And your risk scores, an increase in your risk score, also translate into an increase of the risk score of your community as well. So that calculation is explained in detail in our paper, and the dependability of this calculation, this estimation, is 93.16% if we are estimating 20% ahead of time. Well, in the second scenario, again, expectation maximization algorithm gives us the same, the highest dependable results. And as you can see, the dependability here is more than 98%. So we are 98% dependable. Our decision is 98% dependable if we are making an estimation for the risk scores of the communities 20% ahead of the time. Of course, since the participation is higher here, our dependability of our estimation is higher as well. And this is actually a breakdown of the community risk maps from 50% ahead of time to 20% ahead of time. And as you can see, from highest risk communities at highest risk to communities at lowest risk. So this is in our first scenario, and this is under our second scenario where we had more participants. So these are the risk scores, the community risks that have been estimated from 20% ahead of the time to 50% ahead of the time. And of course, 20% ahead of the time estimations gave us sufficient results, or results that were reasonably realistic. So this is actually the heat map of the risks in the communities. On the left-hand side, we see the actual risk factor of the 8 communities and the predicted risk factors of these 8 communities, whereas on the right-hand side, again, we see the same comparison, but this time we have more participants, as you can see. So we have 30,000 participants here, we have 10,000 participants here, and so we are able to obtain the risk maps 20% ahead of the time. So this is how it will look like from now on to 20% ahead of now. And this is what we predicted for the time. So if we are at t equals 8 now, this is what we predict for t equals 10. And the same here. Okay. So the conclusion here is we are advocating here that the crowd monitoring and decision-making systems, they can significantly benefit from these mobile crowd sensing campaigns to understand the community behavior. And understanding the community behavior will help us predict the upcoming risks and community risks against COVID-19 pandemic. So I presented you here a 4-block COVID-19 community risk mapping framework that is actually proposed on a machine learning backed mobile crowd sensing platform. And you have also seen a feasibility study, some preliminary results regarding our feasibility study that I've presented you here. And what we have seen here is the expectation maximization algorithm gave us the best results in terms of dependability under both scenarios, where we had low participation in our simulations and we had higher participation in our simulations. And when we had higher participation, which was 1.4% of the city of Paris population, we had 98% dependability in our risk score predictions, given that we were making those predictions 20% ahead of the time. So that's pretty much it. And I thank you very much for your attention. I would like to thank again the sponsors of this work, Answer Canada, Knowit, and Litica, our industry partners. So this was actually in support of this project and these partnerships. And last but not least, on behalf of also my co-authors, I would like to thank all the healthcare professionals and also essential workers who have been at the front line of the battle against the COVID-19 pandemic. Thank you very much and stay safe.